Hello, guys. This is Dr. Palaniappan Manickam. Again, welcome to our interview series. I have a very, very special guest, very close to my heart, and regarding the topic that he is interested in. He is Dr. Arun. He is an interventional cardiologist. The meaning of interventional is when there is a heart blockage that has happened, he will go in and then put a stent in to open up the blockage. And as you know, since you're a follower of our channel, we want to make sure that we get there. I mean, we shouldn't get there to start with. I mean, how to prevent the heart blockage. So that has been the concept of the channel. And he also focused more on that as well, more than the intervention that he does as a profession. So only few doctors do that. So I really appreciate what he's doing. So I really wanted to talk to him about what is happening with these early onset heart attacks and what can we do to prevent it. Let's welcome aboard. If you think you got anything out of this video, please do not subscribe. Please consider donating to our non-profit organization called Aishwaryam Trust in Madurai. We take care of hospice patients, patients who cannot walk, talk or move and who require 24/7 nursing assistance. We provide food, shelter and medical care completely free of cost. Please check the link in the description. If you're living in US, you could consider donation to Vannamalargal Foundation so that your donation can be tax deductible. The website for Vannamalargal Foundation is in the description as well. All right. Hi, Arun.
Hi, Dr. Pal. How are you? Thank you for
Good,
having me
good.
on your channel. Okay.
Good. So Arun, he's a senior to me, but he looks much younger and junior to me. It's because of it's because he's focusing on his fitness and he absolutely loves cardiology. Is that right?
Couldn't agree more.
Couldn't agree more.
Although the first part, Concho, too much harga. You look pretty young and dashing yourself.
So, only few people who are like so trained like you are actually, putting stents in the most complex anatomies and most complex heart blockages. And you have trained in US, you're trained in India, you're practicing in Chennai. So you have a very special quality that not many people have. So I want to make sure extract as much information from you so that it'll be educational for me and also for the audience as well. The major question that all my audience asks me is, Dr. Pal, why are we getting these WhatsApp messages that, like people 40, 45-year-old are like dying of heart attacks? Why is this happening? And it's a broad question. If you want to start with in an angle, what will you say, Arun?
First of all, I think the unfortunate thing is that there are a lot of WhatsApp forwards which are not necessarily true. I wish this
Mm,
were the case for this particular problem, but it isn't.
mm,
And if you think about it, right, like unfortunately, I think increasingly we are seeing more and more cardiac disease. Especially
mm,
heart attacks
mm,
happening to people in the prime of their youth. And this now because I'm practicing in India predominantly, I see it even more in our population. It happens a lot
mm,
more than I would say in the typical Western world where we
mm,
used to. Where I used to practice, and now where you are
mm,
practicing still.
mm,
So if you want to break it down, first of all, I want to validate it. Okay, I think it's a real phenomenon. I don't think it's just smokes and mirrors. It's happening. The second thing, if you think about it, is that overall, as you are probably aware of, and I think as a lot of our audience, might be aware, overall, if you look at it, I think we do have a genetic predisposition to it in general. The South Asian cohort, my best analogy is people have all these anecdotal things, but they do it and they don't get it. I'm like, okay, one guy is a SUV, one guy is a race car. Is like we're all built differently, and I think we have to kind of accept that there is some degree of genetic predisposition to it, and this is triggered more. Not everyone, as the whole field of epigenetics, right? Like not everyone who has the predisposition needs to necessarily have it. I think our a multitude of things. I would say the things which we can control, especially our lifestyle, I think has to do majorly contributes to some of the heart disease that we see in our people. And of course, everyone is always like, this is concern going around. Is it like the COVID vaccine? Is it post-COVID syndrome? I think there is, with the COVID vaccine, there was some data to suggest that maybe there's a little bit higher incidence of myocarditis, but overall, it comes out better than not. The post-COVID phenomenon, I do think, is probably real. As we are all now aware, there's a lot more inflammation that happens. It's not just a lung disease. So I think that that's something that that is probably a real phenomenon with inflammation triggering plaque rupture, which is basically what leads to a heart attack. Now, I'm sure you will want to touch upon the whole lifestyle aspect, so I'm going to stop here and let you like ask
Yes,
more
absolutely.
questions.
Yeah. I mean, you hit on the very top three answers that I was looking for. Okay, so one is let's just take the elephant out of the room. So, do you really think that COVID increase the risk of heart attack? We know that COVID increase the risk of myocarditis, which is the inflammation of the heart muscles. Will that increase the risk of heart blockages, sudden cardiac death in young people? Uh,
Um, I
are you seeing that?
I unfortunately see again. It's obviously the gold standard in any of these. So take anything that I say with a pinch of salt.
Mhm.
So there is it's like obviously there's no randomized stuff, etc. In fact, but what has been shown is that there is a higher probability. In fact, recently I think they are looking at it with a very fine tooth comb to see if epidemiologically there is a higher incidence
Risk.
of this, and I think it's a real phenomenon. Now,
Mm,
how much of a higher risk, I think it still remains to be seen.
mm,
But the good and the bad is that this has unfortunately now become like our genetics. Not much you can do about it. I mean, if you had COVID, you had COVID. Like we the answer to how you reduce your risk of having a heart attack is still the same. All the other stuff that that we are going to talk about. I think so. Yes, I do believe it's a real phenomenon. Yes, I think there is some data. Yes, the data is not rock solid, but emerging data just suggests that it does put you in this entire pro-inflammatory state, which puts you at a slightly higher risk of plaque rupture. So myocarditis, I think, has been fairly well established. As you said, the lining, the inflammation of the heart muscle itself.
yeah.
Um, but heart attacks, again, I'm sure some of you guys know, but for those that don't, basically the terms in cardiology, I don't know, it's always confusing, like for the lay public, what is cardiac arrest, what is heart block. So heart block is not actually a heart attack. um,
Right,
so a heart attack basically is, when you think about it, the heart is a pump, and the
right,
heart is very selfish in a way. It
right.
wants to take care of its own blood supply first before it can supply blood to the rest
To
of the
other
body.
part. Mm,
So the blood vessels that supply blood to the heart are the coronary vessels.
mm,
And the basic pathophysiology, the disease process is atherosclerosis.
mm.
So when there is a sudden plaque rupture, so this process of atherosclerosis starts early on, actually late teens, 20s, fatty streaks, and then there's more like this is like a slow process. What triggers a heart attack is basically when there is, and I'm just talking about the most common cause, of course, plaque erosion and malaria, but plaque rupture. So it's like a volcano just rupturing, the plaque, and then there is like platelets, this, that, and all of these congregate and then that results in a blockage in the blood vessel supply to the heart, which results in chest pain, blah blah blah, all the classic symptoms of a heart attack, or sometimes not. And a heart attack is the number one reason why people die in the world, including in India and America.
Mm. No. So the if this is my argument to all my people who are asking, what is with COVID? So we don't know whether it's COVID vaccine or we don't know whether it's COVID infection. Both the groups have been exposed to this, both the groups, and both the groups have some kind of risk of increased inflammation of the heart, and we just don't know how much it is, whether it is of any significance or not. But what can we can control is we can make sure that our heart is strong enough and there is no blockages, so that in case even if there is some kind of insult that is coming along, we will be more in a better position to handle it. So if that is the case, okay, we'll come about preventive aspects before. Before that, the reports of people who are in a gym and then who are having a sudden cardiac death in those people. So that creates a significant alarm in people that they don't want to do any kind of gym, any kind of physical activity. My friend Arun, even walking, he's just walking, sitting on the chair. Because because he thinks that while he walks he might die, or if he lifts some weights and he might die. So he said, why should I do all this? Your take on this?
So I wish I could have these funny anecdotal things about Mr. Sarana Kumar, our friend, but I'll just cut to the chase. I'm not going to try and be Dr. Pal. Um, so see, here is the thing, right? Exercise overall, if you look at the data, clearly it has been shown that people that move, that have physical activity, tend to live longer. It's an independent correlate of longevity, improving heart health, and reducing a chance of cardiac events. Now, couple of things, but the devil is in the details. So if you think about
Yes.
this, yes, when you are intensely exercising, you are straining the heart during that period, because the heart is working harder, it requires more blood supply. And let us say, for argument's sake, you already have a blockage that has not been diagnosed,
Yes.
and you
Little bit.
suddenly
Yeah.
have, and you're suddenly putting yourself in this intense physical activity. So
Mm,
at that
mm,
time, of course, there's catecholamines, this, that, other, all
mm.
that is like, all these stress
Inf-
hormones are all like,
mm.
in the body.
Released.
So
Mm.
briefly, during the period of intense activity and for like some time after, there is a higher chance of cardiac events. Now, that is clearly
Okay.
shown.
Mm.
However, the long-term effect, it's like you're taking that little bit of, your extra risk for mitigating long-term risk. So that has also been very clearly established. Now, it is a big myth that, even patients with heart disease should not exercise. It's a very wrong concept. Uh, because we get these questions all the time. Our heart patient, Madi
Mm.
Erlama, can he like, climb
Mm.
upstairs? Can he,
Mm.
do anything? Basic stuff. Like
Mm.
the
Mm.
clearly, if you think about it, the whole rationale of cardiac rehabilitation is for us to get back on track,
Backward. Yeah, yeah.
so that you can have a functional, meaningful life. And
Yes.
cardiac rehabilitation, if you look at the data, it's a class 1 indication, meaning strong evidence to suggest that this will help you in the long run.
Mm.
Now, what is the difference between cardiac rehabilitation and suddenly working out, or in a relation? Why did I bring that in? If you think about it, if say someone who is in their 30s or 40s, who has been like, overall kind of not very healthy, there's
Mm.
not, and see, maybe in America, like, we have primary care physicians, people go see, get
Mm.
their, blood work occasionally. So, having practiced in both places, some of the stories from India are like truly sad and heart wrenching. Like, they don't see a doctor at all, like, because why go to a doctor? I'm feeling
Mm.
fine, I know my body, so no need.
Mm.
And then like at 35, 40, suddenly they decide, okay, oh, I'm seeing all this stuff now, I'm going to go to the gym and work out.
Mm.
And then
Mm.
there is no plan. It's like suddenly you're hitting 0 to 100 in no time. You're like just stressing your heart. You don't know if you have underlying heart disease. So undiagnosed coronary artery disease is probably the most common reason why people have sudden cardiac death in the gym. Again, there could be other reasons, congenital stuff,
Yeah, yeah,
electrical
yeah.
problems.
Mm.
Let's not
Mm.
talk about the zebras. Let's focus on the
Yeah.
horses.
Horses. Yeah.
Um, yeah. So, the key is listen to so there are two things I tell people. Number one, get yourself checked up. So maybe it doesn't
Mm.
apply so much to the American audience, but to the Indian audience, please go get your basic stuff done. Number one. Number two,
Mm.
be
Mm.
healthy, as we'll talk about. Number three, listen to your body. If you start exercising and like suddenly you feel like, I'm
Too
getting more
much.
winded, I'm feeling short of breath, I'm very tired, stop. It's okay. Rome
Mm.
wasn't built in a day. So take it. அதே மாதிரி symptoms, if you have symptoms, don't try to self-diagnose.
Mm.
It's like people ask me this, how can I differentiate between gastric pain or cardiac pain? Honestly, if we were that good, we would like, I would tell you, hey, these are points 1, 2, and 3. The thing is, when you come to the hospital, we get an ECG, we get blood work,
Mm.
this, that. So my advice to people is, if you have a new symptom, anywhere from belly button to your jaw, or even like, to the angle of up to your ears, that is a new symptom that is lasting for more than like a couple of minutes. Please go get yourself checked out, because it is not worth it. Symptoms can be
Mm.
so atypical. Don't just it's better to err on the side of safety.
Super, super. So let me just summarize what I understood from you. And again, I'm a layman as well in this field. Okay, so I understood that. Okay, so this sudden cardiac death in happens because there is underlying heart blockages, which is not maximally blocking the heart to start with, blood vessels. So you have a little bit of undiagnosed heart disease, And when you exert too much, then probably your heart is not in a position to sustain that extra effort. So that I understand. And but that will happen for 35 to 45, where you develop some insulin resistance, some belly fat, you didn't take care of your
Right.
health. So you need to be very careful when you're exercising, and don't exert yourself too much. And if you are having like windy or any chest pain or anything like that, then stop it and also check with a cardiologist or your primary care doctor. So that's number one. But how about the younger one? Younger one is 20, 25 years of age, where they have sudden cardiac death. Then they might not be related to the heart blockage. And that is where you talked about the other alternative reasons, that it could be electrical problem, it could be structural problem. Am I right? Or this blockage can also happen in young people between 20 to 25?
So that's actually a very very great question. Yes, as we get younger, I think the
Mm,
probability, and let us say we are looking at a younger cohort of people, let us say late
mm.
teens to their let's say 30.
That, okay.
So yeah, obviously for them the congenital problems, heart muscle, sometimes hypertrophic cardiomyopathy, electrical problems, these are more. However, even in that cohort of people, the unfortunate thing is that people think, oh, blockages happen when you're 70. They actually
Mm,
start in their, in fact, there was this autopsy study that was done based in the Korean War, and this is not even our Indian population. Atherosclerosis starts pretty early on in life. Now,
mm.
see, the other thing that can happen is that overall, if you're in kind of an inflammatory state, even if you're in a 20s, I mean, unfortunately, now in the last 3, 4 years, I've seen um, a lot of patients in their 20s, 30s. I mean, people much younger than us, Dr. Paul. It's
Wow.
actually very, it's very, scary. Now it does not even, I mean, people, 25-year-old with instant restenosis. There's so much of disease in our part of the world. And the thing is, even let us say you're talking about a 25-year-old, there might be underlying coronary disease. So see, sometimes what happens is that it's a fixed blockage and there is not enough blood that is going through, and you have ventricular tachycardia or something,
Yes.
some rhythm
Mm,
problem.
mm,
Other times you have this underlying substrate, right? Yeah, this can suddenly, the plaque rupture can go from 30, 40 to 100 in a couple of minutes. So
mm,
this can also lead to a heart attack and cardiac
mm,
arrest and all this stuff. So, the take home is not don't do exercise, but how do you minimize the probability of plaque rupture? And how do you, in the first instance, reduce the whole process? Like, how do you reduce
mhm,
this process of atherosclerosis? What are the tools that we have? I think
mm.
that should be the
That's a
focus,
key thing.
Dr. Paul.
If my patient, right, they ask me, I tell my patient that, if your waist circumference, I have this number like more than 90 centimeters in women, more than 100 centimeters in men, then you could assume that there is some kind of blockages because of the inner fat, that is because of visceral fat, that, as you know. So as a layman, I mean, I need to answer this question as well. I need to get an answer from you. Before doing exercise or anything, you say checkup. Checkup is what? Cholesterol levels, EKG, echo. What do you say?
See, few things. Ipo, when I say checkup, typically when we look at our guidelines, which I'm sure you're familiar with. You keep saying layman,
Mm.
but Dr. Pal, like I'm sure you know this. Um, uh, but like, see, a couple of things, right? See, how many people over the age of 20 know their cholesterol number? Either US guidelines, they say it's like at the age of 20, you should get your first cholesterol check. Our
Yes.
part, and we unfortunately have
So,
much
so
more
I'm sorry.
disease.
I'm sorry. I'll block you. So it's a very important point that you said. So the US recommendation is to get cholesterol levels as soon as possible at the age of 35, right? Or even younger than that.
20ல first, then 5 years ஒன்னு சொல்றாங்க. And but for
Ah,
for for us, like, I would say, like, definitely if it applies to a lower risk population for us, I mean, I think, we have to accept that, right? So that, and
um,
it is not
that's a good
just
point.
that, right? We have
Mhm.
like, see, India, anecdotally I can tell you, there are so many patients whose first interaction is, like, with a healthcare provider is during a heart attack in their 30s, and they'd be like,
Mm.
no, I have no health problems. I was fine until yesterday. Like, suddenly how I got heart attack. Common question.
Mhm.
The problem is they didn't know they were not fine.
Correct.
அப்ப பாத்தீங்கன்னா, they would have had
Correct.
undiagnosed diabetes. They would have
Right.
had, blood pressure higher. Their cholesterol,
Right.
it's like their LDL is through the roof. So, but these are things that they have no idea because they've never checked it. The bad part is these are completely, they don't result in symptoms, right? So people, I cannot feel when my cholesterol level is higher. Many times I cannot
Mm.
feel if my blood pressure is high. and or my my blood sugar is high or insulin jasti. We don't know that. Our body is not designed to give us symptoms during these times.
Correct.
So this is I think a major issue I see in our in our population.
Right, right. So it's a wonderful. There are beautiful important points. I'm just going to summarize this for everybody. As what he was mentioning was, as an Indian patient, especially Southeast Asian, especially South Indian, we are at increased risk of heart disease. So in US, we usually say that check your cholesterol levels at the age of 35, 30. In India, it has to be a little bit earlier. So as early as 20 or 25. If your cholesterol level is higher, then what you said, you should be a little bit careful and diagnose a heart disease and follow up with your primary care doctor or the cardiologist, right? Before working out.
I agree. And Dr. Pal, like one other point is, see, in fact, something. I know you're much more prolific on the social media thing, but one question that I got asked, and I actually put out a reels for this, just was like how, like I've just had a normal ECG and echo.
Mm.
How did the heart attack happen? And
Mm.
because see, when you asked about what is all the what are the checkups that we should
Right.
do,
Mm.
see,
Mm.
people sometimes are lulled into a false sense of security just because they had a normal echo or a ECG.
Mm.
An
Mm.
ECG can be abnormal, in patients who have had a heart attack. Sometimes you can see evidence of that. ECG or echo,
Yes.
you can see that.
Mm.
Likewise, during a heart attack, we get ECG and echo because sometimes your wall motion, that part of the heart muscle might not contract
Correct.
that well.
Mm.
Or you can have ECG changes, like, that ST elevation, MI, blah, blah, blah.
Mm.
Now, just because you have a normal ECG and a normal echo does not mean the blood vessel supply is all clean. So it's
Mm.
in fact, when you have a 40% blockage, let us say in one of the blood vessels to the heart, in one of the coronary vessels, your
Mhm.
echo and ECG should be normal. It is perfectly compatible and it is consistent with the truth. So it is not like, the doctor read the echo wrong or the ECG wrong. It is just that, because the test is not designed for it. But
Right.
in
Right. Right.
the problem is because
I
people
see.
have had a normal test, they just feel like, okay, everything was good. And then the second question comes like, then why did we order all this? You know, because sometimes it can give us, if it is a problem, then we can for sure say there's a problem. But if it is normal, does not necessarily mean that the blood supply is normal.
Mm, mm. So in general, you when the cholesterol numbers are high, or when I said those numbers are on a waist circumference high, which means that you have some kind of inner fat, not the outer fat, inner
The
fat
the
around your
visceral
all your
fat,
organs.
yes.
Visceral fat, not only heart, liver, intestine, pancreas, everything is there. So the concept I want all my audience to take home is that what Dr. Arun is saying is no, it's not to do physical activity. Do physical activity cautiously, and then once you slowly push yourself, you will decrease all this risk, and then you could do whatever you want. So
I
that's
I I agree with you, Dr. Pal. Like, and I'm sure for our again for the Asian population. I mean, many people like
Mhm.
use this whole body mass index, right? The standard for us is even higher, right? I think it's what,
Yes,
23. We should be less than
23,
23.
notice
For the rest of the world, it is 25.
25.
And so and you're so spot on. Like, we have this whole the skinny diabetes kind of thing because
Uh,
outwardly, we are not very big people generally. I mean, although I'm seeing
yes.
that also now. But
Uh,
this whole abdominal obesity that we see, right? Almost it's like our claim to fame. Everyone has a paunch after a certain age. It's normal, right? Like,
sign of
guys,
prosperity.
kind of prosperity. Unfortunately, this prosperity is not going to help us.
Absolutely.
So
The only time Indian men have a flat stomach is during a group picture. So anyway, so now we talked about COVID vaccine, and we talked about the young heart attack. I think this is the best explanation I've heard in a while. Thank you so much. And now we are moving towards, okay. So we know that, okay, we have some kind of inner fat, some kind of fat around the heart, around the blood vessels. So I'm going to put you on spot. Okay, I'm going to say that, okay, if this happens to you, so let's say that you are very fit, but in case your waist circumference is more than 95, and you know that, okay, I saw Dr. Pal's channel, okay, so I need to do something about it. And obviously, you're going to fast. because you're following my channel. But anyways, besides that, as a cardiologist, what will you do? What will be the first step that you look
So no, this is
at?
wonderful. And
If it
first
was
of all,
you.
okay, I'll and this I'm going to like answer kind of as a layperson, but I'll tell you this. First of all, I really, and I'm not saying this because I'm on your channel. I really think you provide some of the best evidence-based, good data that's out there for the common person.
Oh,
Okay,
thank you.
which
Thank you.
I mean it sincerely. No, that's a lot of good work. So um, I couple of things. The first thing that I start with, and I'm a big believer in, hey, I'm very good at putting stents. That's my claim to fame. But it's still, you should try and not come there. So I think the same applies to me
Yes.
also.
Mm-hmm.
So my goal is not to end up on the cat table because I don't trust
Correct.
people. No, jokes aside. So I mean, I will go if I have a heart attack, yeah. But like we should do all the stuff that has like zero side effects, right? So the only
Mm-hmm.
thing, and I tell this to my patients all the time, see, the base of the pyramid is lifestyle.
Yes.
The next tier is like, sometimes, that alone is not enough, and you might need medications like the statins,
Medications.
blood pressure thing, this, that. And
Mm-hmm.
adukku mela, the people that fail that are the ones where your procedures, because as we keep going up the pyramid, yes, fewer people are going to need it, but there is also a risk of, and I'm not saying this to scare people, but look, anytime you have any procedure, we always, get an informed
Consent.
consent. What that means is the
Mm-hmm.
relative benefit is more than the relative risk, but the risk is
Mm-hmm.
not zero.
Is there? Mm-hmm.
Likewise, in America, we see, advertisements for medications, which is amazing and which is ridiculous. But you always see side effects might include blah, blah this. Please talk to your doctor about it. So,
They
medication,
say side effect including death, and the guy on the ad will be smiling.
and then they say talk to your doctor about
Okay.
it. So,
Yes, sorry to
this
cut.
might be right for you. So, the only thing, that we can do with no side effects is the lifestyle stuff. So, what will I do? I mean, I kind of, okay, this is a long winded answer, but I think it's important.
Mm-hmm.
Lifestyle is super important. And one is obviously, I think the intermittent fasting, I'm a big believer. I think because, clearly there have been studies that, I mean, again, I think your audience is pretty familiar. So, I won't focus too much on it. So, I
Yes.
personally do it. So,
Yes.
I think the when you eat is very important. Then there are two more things: the what you eat and the how you eat. I think,
Mm-hmm.
all these three are very, very important. So the when you eat, I think we have, at least do 16, 8, 11, 12, 12. Start
Yes.
somewhere,
12,
and,
12. That's
and
somewhere.
I think your point about like try and not eat after sunset is very, very good. I personally, that's the one thing that I struggle with because I eat one meal a day for the most part.
Mm-hmm.
And then,
Mm-hmm.
by the time I finish work and come many times, in Chennai, like sunset happens in 6:30, even in summer. So, and I try, but the key is I try not to get to bed after, like, right after a heavy meal.
Super.
And
Super.
then I keep walking or do something. So I do that.
Mm-hmm.
The second thing is eat slowly. The whole thing about mindful eating. The phone பார்த்துட்டு, watching Dr. Pal and, you know, even if you're watching Dr. Pal, I would say don't do it.
Yeah,
You
exactly.
eat,
Don't watch. Yeah.
focus on the food.
Mm-hmm.
I think that is very, very important. Try and like, take time to eat. The rushed eating, because you're going to end up eating more. So I think that is a very important component. And the third thing is, again, we didn't really talk about this early on, and but see, I'm a big proponent of whole food, plant based. But
Mm-hmm.
in general, right,
Oh,
I kind
good.
of say to
Good.
each
Mm.
his own. But the best thing, like, see, and this is something that I'm sure you have talked about, is I'm not at all a fan of, like, just diets, gimmicky diets to lose weight. If Atkins, so keto diet, these things, you might lose weight, but you're definitely going to come and see me or somebody like me when we
Mm.
don't do good things to people. So
Not
you
sustainable.
know,
Not sustainable.
not and it's not sustainable and
Mm.
it's not heart healthy.
Heart healthy.
I think
Mm.
so. Because
Oh,
so weight
wait.
loss.
You're saying that paleo diet, I mean, what diet? Keto diet is not heart healthy, right? I mean, because of
No,
the studies have been shown.
keto, paleo. Recently, I think, just AHA published a guidelines ranking the diets.
Ah,
Edu
sorry.
most heart healthy.
Yeah, yeah, yeah.
At the top of the tier.
Mediterranean, right?
You had Mediterranean, you had the
Mediterranean.
DASH diet, you had
Mm.
a pescatarian diet and a vegetarian diet. See,
Mm.
and the my for a lot of people, whole food plant based, they find it very restrictive. I don't. Okay,
Mm.
so
Mm.
but to me, I kind of say like how far you can go, you go. But if you are on a completely plant based diet, I would say watch your B12, vitamin D, consume. Just make sure you
Correct.
get enough of those, because that's the other big problem that a lot of I think us have is low vitamin D levels. So
Mm.
இதெல்லாம் check
Mm.
பண்ணிப்பேன். So if I had
Mm.
a waist circumference that was more than acceptable, I would watch my diet. I would
Super.
ensure that I get enough sleep, because if I'm sleep deprived, then I'm going to end up binge eating. I'm going to do all the wrong stuff. And it,
Super.
independently, it makes you stress level, everything. You'll pack on more pounds. The third thing is physical activity.
Mm.
At least I would say all of us should aim and, at least do 30 to 40 minutes of moderate activity, 5 days out of 7 days. More, okay, it's fine. And I'm
Mm.
not saying, you need to run marathons. I'm not saying, but at least moderate activity. People need to move. And I do want to also touch upon one thing. This probably applies to a lot of our kind of, we unfortunately many of us have sedentary jobs. So in fact,
Mm.
recently there was this study where they showed, if you get up every 30 minutes and just walk even for 5 minutes, kind of brisk walking, come back, overall your mood is better. You're less likely to the annul the I mean you're more likely to annul the side effects of the sedentary, the sitting prolonged
Mm.
times. You should try and
Mm.
avoid that. So I think these are the things that I would start with. Of course,
Super.
நம்ம audience சொல்ல வேணாம், don't smoke, don't vape, all of that stuff goes without saying.
So let me ask you that. I really want to focus on that. When I was growing up, right, in Madurai, if I go and tell my dad that, I drink alcohol and that's it, I'll be outcasted socially. Right? But now, I mean, I'll be thrown out of the family. But now, if I don't drink alcohol, now I'm getting socially outcasted. I thought that was only in Western medicine, Western culture, but that's not true. Even in India, I see, I mean, I hear experiences as well. The smoking and alcohol, has that increased in the last decade? And what is your take on that?
Absolutely. So three things: smoking. I see vaping. That's a lot more. See, I mean, 5 years, 6 years ago, I was like vaping. No, I didn't even know
Yeah, yeah.
what is this vaping.
The only
But
vape
like,
I know is Vicks vapor.
good one. But like, I it has definitely increased a lot more. And the sad part is, I grew up in the 90s too, right? In India,
Yes.
but it's the
Yeah.
80s, 90s. So, Apo, at least women, we never ask an Indian woman,
Correct.
do you smoke? I mean,
Yes,
smoking history, na.
exactly.
It's
Right.
like, what are you asking me? Now, I see a lot of the younger folks, they've taken on tobacco. So it is, it's kind of one of those cool things, or, unfortunately, across both genders, it was ஆரம்பிச்சிடுச்சு.
I see.
Um,
Mm.
and vaping is the other new thing, especially I think in the next gen, in the 20s, happens
20s.
a lot,
Mm.
alcohol. You're absolutely right. It's like you become like, no, குடிக்க மாட்டியா? And no alcohol. It has become the
Or,
social thing.
அவன்
Uh,
கேக்குறாங்க, are you okay? அப்படிங்கிறாங்க. Are
and
you
and
okay?
and the problem is, see, the data on alcohol, if, there were some studies which said, well, maybe uh, 1 to 2 drinks is
Moderation.
okay, it's okay.
Mm.
But now if you look at it, the guidelines don't actually recommend it. They're saying this is the
Yes.
maximum allowed thing. And the other big thing I tell people is, maybe you will have a funny joke on this. See, the one drink, it doesn't work. It's an addictive substance. It is just not worth the thing. And who stops with 1 year? I mean, like after a point, people like, when you lose count, oh, come on, one more thing. And then clearly, moderator தாண்டிடுச்சுன்னா, it does not correlate with good outcomes at all. And even this whole moderate alcohol, it's, maybe heart health, the data is kind of, maybe a bit mixed. But when you look at your cognitive thing, your, all of
Sleep.
those things,
Sleep.
sleep. Totally, it
Absolutely.
affects
Mm.
so many other things. I mean, so I'm not going to get on this moral high ground and say, you're bad or anything, but it's definitely not worth it thinking it's helping your heart. Please don't do
Correct.
that. And of course, smoking and vaping, absolutely, it does nothing to suggest that it helps your heart.
Let me tell you one situation. So 20s vaping is pretty common, but now in 40s,
Mm.
where I see a lot of people, a social gathering, as you are bringing the point of like one drink a day. So I'll tell you the American guidelines. So what they say is 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of liquor is okay. What does that mean is it is okay that it will cause a little bit of damage. I mean, you're okay to take
Maximum,
that
yeah.
one. You go beyond that, that's it. But the problem is, if you are stuck with just 12 ounces, this is one can of beer, நிறைய பேர் வந்து, if that is what I want, then I will not have it at all. So that is the thing. And I always say that my patient always tell me, I drink only one glass every day. But the glass is a fish bowl. It's a
So
fish bowl.
I actually thought you were going to bring up Saravana Kumar now and say, but my glass is this big.
Yeah, this big. It's a fish bowl. And I also tell my patients that, okay, if you want to drink alcohol, I mean, you shouldn't drink alcohol at all, even one drink. But if you want to drink alcohol, at least drink alcohol in the afternoon. Because all these various bleeds come at night that it disturbs my sleep.
Yeah, and see, and I'm sure you see a lot of that, right? Like, I mean, all the bad stuff. I mean, I didn't even talk about the liver and the. I mean, I
Yeah, yeah,
can't
yeah.
preach,
But just
preach to the
heart
choir.
heart thing, heart itself, I think people are forgetting about smoking and alcohol. Smoking and alcohol is the number one risk factor for heart disease, more than all the other physical activity and everything.
Smoking, among us, smoking, I mean, and alcohol, my big thing is like people don't stop. That's the problem. It's a,
Correct.
see, nobody realizes how little alcohol is actually, it's a maximum allowable alcohol. And, if you look at patients in less than 50, smoking will increase your risk tenfold. So it is
Uh,
not an insignificant number. And, on top of that, we have family history. Other than it's absolutely, I mean, like, it's like saying, how many people will close their eyes and cross the road? They won't. But for some
mm,
reason, because, we are not, it doesn't happen right off the bat, people just, um, the risk reward sensors in our brain, they don't work as well, I guess, because the risk is not immediate. But I'll tell
mm.
you this, right after, you smoke, we all are concerned about intense exercise, gym deaths, and all this. Right after we smoke, our risk of heart attack increases. So if
Mm.
people are that, yeah, actually it does increase it. Long
Yes.
term, certainly increases.
Certainly. Yeah, yeah, absolutely. So, I mean, we touched upon so many topics, right? But I want to get even more personal on your day-to-day practice, right? So, you have that patient where, I wish that I could have intervened before, or I wish this message could have been spread to everybody else. So, you see heart disease patients like every day, right? Can you wrap up the session by saying that one personal experience that you've seen a patient and a lesson that others like me should learn from it?
So the
Take your
biggest
time.
thing I would now couple of things. Thanks, Dr. Paul. Like that was
Mm,
a very important thing, and because practicing in India in the last few years has now it actually hits you home. I mean, like it hits you really hard and
mm,
it's very personal. We see
mm,
number one, I think young patients பார்க்கும்போது it really hurts you.
mm, mm,
The sad part, and you asked me one, but I can tell you this is like a recurrent pattern. Successful people who have like good IT jobs, this that India, they're just young kids. And then all of a sudden, like let's say there's a heart attack or a heart blockage. It's such a life altering event. See, Namak, we all live in this perception that this will not happen to us. I mean,
correct.
all of us
Correct.
do until it happens. So, people they plan their financial stuff in the car, house, kids, marriage, and then all of a sudden this happens, and then it that is when. I wish I could go back in time and tell them, look, I could, if they could talk to their or 10 years ago self and say,
Mm,
like, start working on stuff now. Watch what you
mm,
eat, avoid the
mm.
tobacco,
Just
please
respect your body.
exercise,
Mm,
exercise பண்ணுங்க. Stress, every time we keep hearing this, எனக்கு ரொம்ப stressful job. I mean, I'm sure Dr. Pal has a very stressful job, unfortunately, most jobs are stressful, and I tell this to patients all the time. இல்லைங்க, யாருக்கு தான் stress இல்ல? The only way you can avoid stress is by not doing anything. Other that will have its own stress. So, uh, you know, and this is like, not to sound all preachy, but we can only so much control our external environment. But then how we respond to that, I think, knowing that we can control some aspects, and accepting those things that we cannot, or at least how we react. So that stress thing, இதெல்லாம் learning to manage all this from an early on age, so that in the mid 30s, I mean, these guys are still young, prime of their career, or still early career. Seeing this is very very saddening. And then the other, the few other things, and I know this has not to do so much with prevention, but I see this in India a lot, is like, once they've been diagnosed with heart disease, they have this avladan, death sentence, life, it's changed. What is going to happen, so I also want to send a message. Yes, please focus on prevention. That is the most important thing. Anal, if let us say you do have a let us say when diagnosed with heart disease, don't take it as nothing can be done. In your 40s and 50s, if you're told there is a blockage today, it might take some effort, some expert to open or something, but almost anything can be taken care of. Now, please note, I am not saying can be cured, but you can still have a long and meaningful life. But you still have to do all the lifestyle stuff. Unfortunately, what patients do for themselves is, I would say, more important than what I can offer to them. It is about reducing that second risk, second event, and reducing a risk. So heart-wrenching stories, time and again we see young people, it happens. Oh, the other thing, women. I'm so sorry, Dr. Pal, idhu na sollirren. People have this big myth that women don't get heart disease. The number one killer in women, not just postmenopausal, it's still heart disease globally and in India. India, people have, especially this diabetes and heart disease, twins madri, there's so much of disease in not just men. So we keep thinking heart disease, men, women, breast cancer, the numbers are so much lower compared to heart disease. So women go, for your women audience also, I would say, please focus on your heart health. Super important.
Yeah, absolutely. I say that, I always promote sleep a lot in the, but women should sleep like 1 hour more than men. The reason being is that I always promote hormonal symbiosis, circadian rhythm. You need to respect your hormones. You remember, women have so many hormones. We only have like testosterone or something like that. So we'll take care of it. But their hormone should be in such a musical orchestra like Ilayaraja, right? It cannot be like Anirudh. It has to be.
Anirudh Kudukura fan.
I mean, it's good. So it has to be like, synchronized with a mega synchronized version. So all this, what you talked about, is very, very important in women more than men. But anyway, that was a wonderful, wonderful summary. It was a wonderful talk. I'm pretty sure that many of my audience have taken multiple take-home messages from this. Thank you so much for your time, Dr. Arun. I really, really appreciate it.
Dr. Paul, thank you so much for having me in your channel. Hope your audience found it useful. In fact, I had so many questions to ask you, but keka mudiyala for another session.
Yes, absolutely. Absolutely. And the audience, please follow Dr. Arun. He has an Instagram handle as well. He has a YouTube channel. Please follow him. He's putting out some wonderful tips. And again, what I really like about him is, he is telling all this. If you follow all this, you guys will not go to him and his business will be affected, but he's okay with it.
Please do.
He's okay with it. You will see only such good-hearted doctors only. Everybody should think about prevention rather than treating. That's why I say the medical system is broken. So we need to really focus more on prevention. Again, thank you so much for joining, Dr. Arun. Thank you so much for your time.
Thanks, Dr. Paul. Thank you. Take care. Bye. See you. Bye.